My name's James Schlenker. I'm a plastic and reconstructive surgeon at Virginia Mason Medical Center, specializing in melanoma care. Melanoma is a type of skin cancer that arises from the cells in the skin that produce melanin, or pigment. It is one of the least common of skin cancer types. There'll be just under 100,000 new cases of melanoma in the United States this year. It is the most common type of cancer in younger patients. Many melanomas are easily detectable, which is important. We really stress self-skin exam and awareness around changes in moles that may prompt an evaluation. In patients that have a family history or personal history of melanoma, it's good to have regular visits with a dermatologist for skin surveillance. An important thing to know about melanoma is that many skin cancers are easily detectable early on, and outcomes are better with early detection. When melanomas are identified when they're thin, when they're first changing, often they can be cured without an operation. So surgery tends to be the frontline therapy for melanoma when it's early. The challenges in treating melanoma really come down to at this point, deciding how best to proceed with management, given that we have a variety of options, particularly on the medical side of care, for high-risk or advanced melanoma. Many thin melanomas can be cured with surgery, and that tends to be the frontline therapy for straightforward melanoma diagnoses. For patients with more advanced melanoma or recurrent melanoma or high-risk melanoma, that's where we really draw on some of the newer options that we have for treatment in the realm of medical oncology. These agents are very different than standard conventional chemotherapy that people may be familiar with. Over the last 10 years, there's really been a change in the landscape of melanoma care, so that we have new options on the medical side of things that are really exciting. There are new drugs that target the immune system to help amplify that, to identify melanoma cells and help take care of that. There are targeted therapies where we identify specific genetic mutations or changes in a tumor cell, and those therapies target those sites specifically. There are clinical trials available now that help narrow down the focus of which agents may be most appropriate for particular patients. Over time, we've found that combinations of some of these agents may be more effective than using a single agent on its own. And so sorting through all of these plethora of options that may be available to a patient really requires that multidisciplinary discussion. And that's where we draw on the expertise of our medical oncologists, our clinical trials, all of the investigators that are involved with those, deciding what things we may present to a patient as options for moving forward. And ultimately, among those options, the decision about how best to proceed really comes down to what a patient is most comfortable with. One of the best things about working at Virginia Mason for melanoma care is that we have a very patient-centered focus. And we have a comprehensive melanoma team with tremendous ability to communicate between the team and collaborate and really draw the patient in as an important member of that team. And I think it really contributes to the best outcomes. Patients feel comfortable with our team, they feel a part of the team, they feel that they're contributing to decision making. One of the best things about having easy communication and collaboration among team members is that it really expedites decision making toward a plan that patients are comfortable with and that fits their lives best. One thing that's often very important to patients is timeliness of care. So from the moment of diagnosis, which can be very scary, to how we formulate a plan and the next steps and how quickly we can move forward for them. That's something that I think we do very well at Virginia Mason, from the point of diagnosis through definitive management, be that an operation or a consult with a medical oncologist or additional radiographic staging. Those are things that we can really expedite and move forward with. We're committed to that. So from the moment we get a phone call from a patient with a new melanoma diagnosis, we can generally have a clinic visit scheduled within days. We can have an operation scheduled within a week or two. Our goal is to really meet the patient's time frame. One of the important components to melanoma care is having a multidisciplinary approach. That's true from the most straightforward, early detected thin melanomas through ones that are higher risk or advanced. One component of that is having a multidisciplinary tumor board, and we do that at Virginia Mason on a regular basis. So all of the providers that have contact in melanoma care, be it dermatopathologists, radiologists, medical oncologists, radiation oncologists, we all come together regularly to review complex cases and help with decision-making around options for moving forward for the patient. And it's really a starting point for identifying possible paths that we can present to the patient. With the team that we have at Virginia Mason, with specialists coming from multiple areas, we really are able to manage the entire spectrum of melanoma occurrence, meaning we can take care of patients with the thinnest, earliest detected melanomas that are really often managed with a fairly straightforward operation, through those with the most complex advanced scenarios in terms of melanoma occurrence. And to do that, we really draw on the expertise of a comprehensive, talented, multidisciplinary cancer team.